Hello, and thank you for joining me. My name is Lindsay, and this is a presentation on patellofemoral pain syndrome. This is for the Nurse 440 Community Health Nursing class for Indiana State University LPN to RN program. If you would take a moment to stop here and complete the pretest that is in the link posted in the comments to determine your current knowledge of patellofemoral pain syndrome, that would be appreciated. Alright, patellofemoral pain syndrome is technically a broad term used to describe pain in the front of the knee and around the patella, which is the kneecap. Those at risk tend to be athletes, runners, or people who jump a lot. Patellofemoral pain syndrome is commonly known as runner's knee or jumper's knee due to it being common in people who participate in those sports, but patellofemoral pain syndrome can occur in non-athletes as well. The pain and the stiffness caused by the patellofemoral pain syndrome can make it difficult to climb stairs, kneel, and perform other everyday activities. Alright, those at risk are going to essentially be mostly athletes, such as those who do running, jumping, squatting, and stairs. But there are other reasons, such as dynamic valgus, which essentially your lower extremities don't move correctly when they bear weight, so they move to the side versus staying centered and stable. Females have a higher risk. Those with foot abnormalities, such as super flat feet or a really hard arch. Overuse or sudden increase of physical activity. So if you suddenly go from being sedative to doing a super intense workout regimen, this is a high probability. But patellar instability, which just means that your kneecap isn't anchored as well as it should be. And this comes from a multitude of things, but mostly weakness, such as the quadricep muscles, which are the big muscle on the front of the thigh, hip tightness or weakness, hamstring tightness, which is the muscle on the back of the thigh, or the iliotibial band tightness, and that runs from the hip down the leg. Weakness or super tight in any of these areas cause instability in the kneecap, which causes pain when you do essentially anterior or front loading exercises such as squats or lunges or stairs. So, signs and symptoms. Patellofemoral pain syndrome has some pretty specific signs and symptoms. It's going to be pain in and around the kneecap that happens when you are active, and mostly this is towards the top of the kneecap and feels like it is sitting directly behind it. This after you sit for a long time with your knees bent, so if you work in an office and you sit for most of the day and then you stand and your knees are real stiff and painful when you stand up. Pain going up or down stairs once you get that weight on that leg. When you step up or down, it tends to cause pain again in that top area and back behind the kneecap. You may hear rubbing, grinding, or clicking with the kneecap when you bend and straighten your knee. And then another giveaway is a tender kneecap. So if you touch your knee and it is painful in that top area or behind that kneecap, that's a pretty predominant sign that you may be experiencing patellofemoral pain syndrome. Alright, diagnostic testing for patellofemoral pain syndrome is mostly just obtaining a history and doing a physical exam. Important parts of the history that they will want to go over, or you will want to go over, is previous knee injury, any previous knee surgeries and activity level, and any recent change in activity level. Physical exam is going to include the patellar face tenderness, so that is that part where we talked about if you touch the front of your knee or the top of your knee, it's painful. Pain during squats, as squats are a front load bearing exercise that cause that extra pressure on the patella or the kneecap, a patellar apprehension test, and essentially this is also known as a Fairbank apprehension test, and it's used to test whether the patella is likely to dislocate or not. If it is positive, which means that it is likely to dislocate, it is also a tendency to have recurrent dislocations, and in which case the patient will be apprehensive and try to stop the test, generally by pushing the examiner's hand away. The other test that they could do is a patellar tilt test, and that's going to be done lying on your back with your knees stretched out. Your patella should be parallel, and what's going to happen is the provider or whoever is performing the test is actually going to try to push the kneecap inside or outside with their thumb. Essentially, they're going to try and get it under the kneecap and see if they can get it to move up or down outside of its normal range. Imaging is not usually done to diagnose patellofemoral pain syndrome, but more so to rule out other causes of knee pain, such as a cartilage tear or ACL, something along those lines. All right, treatment for patellofemoral pain syndrome most often is going to be physical therapy, and that's going to be to get those muscles we talked about, the hamstring and the quadricep and that iliotibial band strengthened and relaxed if it's real stiff and needs to be stretched. Medications, usually anti-inflammatories of some sort. Orthotics, that's going to be mostly for people who have those foot issues that we talked about. Stretching, so yoga, at-home stretches, anything to get those tight muscles loosened up. Compression, so if you are someone who is really physical active, something like a compression sleeve or a compression knee pad that you can wear during workouts will help with the pain there. And then position avoidance. And the three big positions that they recommend avoiding are lunges, deep squats, and leg extension machines if you are a gym goer. There is not really any surgical treatment for this condition. Again, it's mostly therapeutic, treating the things that cause it and then avoiding the things that make it hurt. There's not a whole lot of things to do to prevent the patellofemoral pain syndrome, but there are some. As with most things that involve joints, being overweight increases that pressure, so weight loss will help with joint pain, and patellofemoral pain syndrome is a form of joint pain. Stretching, again, getting those muscles that can be tight, nice, and loose. Gradual activity increase. If you decide you want to start losing weight or you want to start going to the gym, start slow. That quick, rapid increase in activity can start or worsen the patellofemoral pain syndrome. Good shoes, again, that's going to be for that good foot support to make sure everything is in correct alignment. And then if you are a runner, your posture can definitely make a difference. So with running posture, you want to make sure you have that slight lean forward from the ankles and not from your waist. You want to hold your torso and your head up tall, eyes and head up and forward. And essentially that, you can, no, that's really about it that you can do for prevention. It's just one of those things that is more so avoidance of things that irritate it and doing the things that you can to decrease the amount of pain that you have with it. So that is the end of my presentation. I thank you for taking the time to join me. I do have a couple resources here that I use to obtain this information if you wanted to research it further. I will ask that you stop and take another second to complete the post test for the patellofemoral pain syndrome presentation to see what kind of information you have learned. Again, thank you for your time.